Hello, my name is Tiffany Turner and I am with Indiana State University and I am working towards my bachelorette degree in nursing. This project is for Nursing 444 Community Health Nursing, and this is my health education project, which is on education for the sexually active young adults on sexually transmitted infections. Learning objectives. The audience will be able to describe ways to practice safe sex. The audience will be able to identify the most common types of sexually transmitted infections. The audience will be able to define how sexually transmitted infections are transmitted and the importance of testing. The audience will be able to define the signs and symptoms of sexually transmitted infections. The audience will be able to identify how sexually transmitted infections are treated. And finally, the audience will be able to describe where to obtain more information related to sexually transmitted infections. Please pause the video at this time and take the pre-test to test your knowledge prior to the presentation on STIs. Population at risk. My population at risk are sexually active young adults in Washington. Nearly 210,000 babies were born to teenage girls aged 15 to 19 years old in 2016. Half of the 20 million new STIs reported each year were among young people between ages 15 to 24. According to the CDC, in 2017, a survey was conducted for high school students who are sexually active and found the following. 40% of students have had sex before. 30% of those students have had sexual intercourse during the last 3 months. And of these students, 46% did not use a condom the last time they had sex. 14% did not use any method to prevent pregnancy, and 19% had drunk alcohol or used drugs prior to their last sexual activity. And 10% of students have had 4 or more sexual partners. Consequences of risky sexual behavior can lead to sexually transmitted infections from vaginal, anal, and oral sex, hepatitis B and hepatitis C, HIV, pelvic inflammatory disease, which is called PID, which can lead to difficulties getting pregnant, cervical and or other genital cancers, unplanned pregnancies, and bacterial vaginosis. Ways to prevent STIs includes prevention and safe sex practices. Safe sex practices includes abstinence, which is the only way to prevent STIs, the use of condoms, to get tested, which is the only way to know if you have an STI, monogamous relationship with your current partner, vaccinations, which can include the HPV and the hepatitis B vaccines, reduce the number of sexual partners, and also avoid drugs and alcohol prior to sexual activities. The sexually transmitted infections that are going to be discussed in this presentation include chlamydia, gonorrhea, genital herpes, the human papillomavirus, which can lead to genital warts, and syphilis. Chlamydia, a bacteria transmitted through sexual fluids during sex with an infected person. The incubation period for chlamydia is 1 to 3 weeks. Chlamydia is the most common STI in the U.S. Prevention, you can practice safe sex and have regular screenings. Some people may not have signs and symptoms, but symptoms may show up weeks later, and those symptoms can include burning or painful sensation with urination, abnormal vaginal or urethral penis discharge, bleeding, and pain with intercourse. Complications of chlamydia, if untreated, can lead to infertility, ectopic pregnancy, and pelvic inflammatory disease. To diagnose chlamydia, they assess the bacterial cells, and if they are present with bacteria, then it is positive. And the specimens can come from the cervix, vaginal, or from urine samples. To treat chlamydia with antibiotics, such as azithromycin, for the infected person and also their partner. And you can also abstain from sexual activity until the full course of antibiotics is complete. Gonorrhea, a bacteria transmitted through sexual activity affecting the mucous membranes of the reproductive tract. The incubation period for gonorrhea is from a few days to 1 week. To prevent gonorrhea, you can practice safe sex habits. Most women do not have symptoms, but the symptoms can include mild bleeding between periods, purulent yellow-green urethral or vaginal discharge, and painful and burning urination. Complications, if untreated in men, can lead to infertility, and for women, if it goes untreated, it can lead to PID, infertility, ectopic pregnancy, and chronic pelvic pain. It can also lead to fever, skin lesions, joint pain, swelling, and redness. To diagnose gonorrhea, they use a vaginal and urethral secretion swabs, and they are tested for the infection. Treatments include both an IM intramuscular Rocephin and an oral azithromycin combination used together. And you need to treat your partner as well. And during the treatment, you need to abstain from sexual activity up till 1 week after the completion of the antibiotics. Genital herpes is a recurring virus caused from the herpes simplex virus 2. Even without signs and symptoms, the disease can spread with sexual activity. And transmission can also occur through the contact with the herpes sore and the genital secretions. Most people with the virus do not know they have symptoms or even know they have the disease. A person with oral herpes performing oral sex on their partner can infect their partner with genital herpes. To prevent genital herpes, you need to avoid sexual activity when the sores are present and the use of condoms. Although, keep in mind, condoms do not fully protect, as the sores may occur in areas not protected by the condom. Signs and symptoms of genital herpes include burning, itching, or tingling sensation, painful vesicles, ruptured vesicles, which is a shallow, moist ulceration, and then the ulcer crusts over. Also, local inflammation, fever, headache, and fatigue. And to diagnose for genital herpes, they can culture the lesions, and they can also do an antibody blood test. There is no cure for genital herpes, although you can take some antivirals, such as acyclovir, to help prevent and shorten the outbreaks. You can also take a daily suppressive therapy to help reduce the risk of transmission to your partners. And you also want to treat the discomfort that's related to the painful lesions. HPV. HPV is a virus disease that can cause genital warts and is transmitted by skin-to-skin contact and during sexual activity. HPV can be spread even when an infected person has no signs and symptoms. HPV can lead to cervical cancer. To prevent HPV, one can receive the HPV vaccine, have regular cervical cancer screenings, and practice safe sex habits. Signs and symptoms can include the genital warts appear cauliflower-like, white to gray, or pink-fleshed, or people may not have symptoms. To diagnose for HPV, they can do a biopsy of the growth. They can also test the HPV virus from a specimen from the female cervix. There is no treatment for the HPV virus itself, but one may remove a symptomatic wart. Syphilis, a bacteria transmitted with direct contact with the canker during sexual activity. The sores may not be visible as it can be inside the vagina or hiding in an orifice. To prevent syphilis, you can practice safe sex behaviors and avoid sexual activity when the lesions are present. There are stages of syphilis, and if not treated promptly, the disease progresses to the next stage. The primary stage of syphilis is within 10 to 90 days post-exposure, where painless sores appear on the lips, the genitalia, and there could be drainage of blood, which is highly infectious, and this stage can last 3 to 6 weeks. Secondary stage of syphilis occurs a few weeks after the canker heals, and one will have flu-like symptoms, sore throat, mucus patches in the mouth, weight loss, and a symmetric non-itchy rash on the trunk, hands, and feet. And this stage can last 1 to 2 years. In the latent stage, There are no signs and symptoms, although you still have syphilis in the body. The tertiary stage occurs 1 to 20 years post-initial infection, and it may affect the heart, blood vessels, brain, and the nervous system, bones, and the liver, which eventually can lead to organ damage and even death. To diagnose syphilis, they do a blood culture and a specimen of the syphilitic sore, and treatment with an antibiotic, an IM intramuscular of a penicillin G. Please pause the video at this time to check your answers from the pretest and see how well you did. Online and community resources to find more information on sexually transmitted infections can include going to the website for Center for Disease Control and Prevention website, the CDC, which is a really great resource, the American Sexual Health Association website, and the healthfinder.gov website. For places in your local area to find out more information, one can visit the local health department, the school nurse, or even your primary care provider. These are the references that I use to find information for my project. So I just want to thank you guys for taking time to listen to my presentation, and I hope you guys have a great day. Thank you.